Good afternoon, everyone. I am Dr. Rakhee Sharma, and today I am going to talk about the trigger. So, first of all, we are not supposed to trigger each other. We have to trigger the follicle first. So, how? Now, when our 75% of the cohort of around 20 follicle is ready, then we are ready to give the trigger, number one. Now, what we have to do, this is the board. Like for the antagonist cycle, it is different, and for agonist, it is different. For the antagonist cycle, the trigger will be the GnRH agonist. And for the agonist cycle, that is a long protocol, the trigger will be the HCG. Now, what we are supposed to do, on the day of trigger, we need to give this antagonist cetrorelix 0.25 milligrams in the morning, and we have to omit the dose of HMG. Then in the night, approximately after 12 hours, we need to give GnRH agonist. Either it could be leuprolide, which is 2 milligrams, and or it could be the decapeptyl, which is almost 0.2 milligrams. And then we are ready to take for the ovum pickup after 34 or 35 hours. Fine. But in the case of HCG, like since we know agonist is a pituitary down regulation, so we need to give the HCG as a trigger. That is, the dose is 6,500 international units or 250 micrograms. Now, one more thing over here. When we are ready to give this, like when we have given the trigger, there is a options of doing LH. If we have a availability of LH, then we can go for it. And if the levels of the LH are more than 15 international units, then it's okay to do the pickup at timing pickup. And if the LH levels are less than 15 international units, then we have to repeat the sample again. And again, if the value comes out to be less than 15, then we need to give this recombinant HCG 6,500 international units or 250 micrograms and do the pickup after 30 hours. So this is a check here. Thank you.
I think what will happen if we'll give agonist trigger in agonist cycle and HCG trigger in antagonist cycle?
See, if we give agonist trigger in the agonist cycle, since we don't have the hormones available in the pituitary, so there is no hormones, there is no need, there is no flare, so we need to give HCG because there is no LH in the pituitary. So agonist action is, so there is completely no.
Okay.
And for the antagonist cycle?
If I give HCG in antagonist cycle?
HCG in the antagonist cycle. We can give, but there is a risk of the ovarian hyperstimulation syndrome.
We can recombinant HCG have to use, or
recombinant is the better one compared to urinary. We can give both people, but it is the preferred one.
Can you throw some light on dual triggers?
Okay, dual triggers we can give, like for in the dual triggers we can give both. It's a agonist as well as the HCG, but the dose of HCG is reduced there. That is 2,000 international units, and in this we have to give the entire, but the dose of agonist remains the same.
But where should
which condition?
Where should we?
In which condition should we?
When the LH levels are less, then we can give in this. But we
So that is not dual trigger.
but we do
Poor routine for people nowadays.
okay.
But works very well for a poor response.
Poor responders, yes. It's work for
Poor responders.
Very nice.
Okay.